Hi, Dr. Tam here, and today I'd like to talk to you about longevity and how do you live a long life? I mean, how does chiropractic, how does decompression, losing weight, overall, when you put health together, how do those things help you live a longer life? Well, here's a few things that we know. Number one is that gravity is the biggest stressors to your body because gravity is what keeps us grounded. But it's also the one thing, if your spine is not aligned in the right place, it's going to pull you down at an abnormal position. And just behind me here, we have some bone models. And naturally, when you look at these bone models here, it's as if I'm standing on my side, right? And you're looking at me from the side. You have the spinal cord coming down, which is really just the tail of the brain. As the spinal cord comes down, you have disc, bone, and disc. And the spinal nerves come out to the rest of your body between two bones and a disc. Well, the disc, think of it as a cushion for the nerve to come in and out freely. Think of it as a doorway, a pathway. To keep that doorway and pathway open, you have to have a healthy disc. But in the event, if there were accidents and injuries, as we are getting older, we are more prone to prior injuries. Maybe things that we didn't even think of when we were young that could affect us later on down the line. It's like a car. When you drive a car right off the lot, brand new, you hit the curb, let's just say on your first turn. Immediately your alignment's off, but your tires and brakes and shocks and everything is still brand new. But let's just say you never work on your alignment and 10, 20 years later down the line, well, your tires are wearing out, maybe even sooner, maybe 2 to 3 years. Tires, shocks, brakes, everything starts wearing down. That's what happens to your spine. When we're younger, well, naturally we have an injury. We just put some dirt and rub some ice on it and just kind of call it a day, right? But over time, a misalignment of the spine can cause a wear and tear that is not normal. A non-normal wear and tear will start to eat away at the disc and cause a lot of problems around the bones. And over time, this could be 10, 15, 20, 25, 30 years later, well, you can have a spine where it's normal right here, so you can see it up close, to now where it is, well, right here, is along the spine in that area. So when you put the two together and when you look at these two, what can help this person prevent them from getting to here 15, 20 years down the line? Or if you are indeed already here, what can prevent you from, well, getting even worse, which is here? So if you're here already, what can prevent you from getting here? Number one, what got you here from the first place is the poor alignment of your spine, because a poor alignment will start to cause wear and tear, abnormal wear and tear. Now, when you go to the doctors or you have an x-ray taken, and if they say, hey, it's just old age, you have to know that's not the case, because the rest of your spine is the same age. Why is it that maybe 1, 2, maybe even 3 are really, really worn down where all the other ones are completely fine? It's not due to age. It's due to a misalignment of the disc and the spine and the bones all put together. And when you put together your spine as a whole, it becomes a bigger problem than just old age. So the first thing that we do is, number one, you have to correct the alignment, because no matter what you do, if you don't correct the alignment first, no form of exercise, other parts of healing, doesn't matter what food you eat, because if you don't correct the alignment, this bone will continue to wear and tear advancedly, very quickly, I might add, until you get to here, okay? It's gonna start wearing and continue to wear at a very quick rate. So to really show you what needs to be done, well, let's look at the whole spine set. This is normal. This is phase 1 into degeneration, phase 2, and then you get to phase 3. Let's just say, well, let's just say your lower back, L4 and L5 is no longer in phase normal. It's in the phase 1, or maybe it's in phase 2 now, let's just say. Well, within phase 2, you have the disc that's already starting to collapse, herniate, depending on maybe there's disc protrusions. On top of the alignment, also, spinal decompression will help release the pressure of the disc, and really get your body into a healing phase. So what happens in spinal decompression is as you're laying in the bed, literally your body is being tractioned and decompressed so that the pressure is taken off the nerve. The disc has a chance to regrow, rehydrate, and reheal. Yes, discs can heal, okay? And over time, with correct spinal structure, with correct adjustments, with the right nutrition and with the right exercise and stretching, you can prevent a lot more problems so that this won't end up being here as quickly as it came from here to here. So that's why getting adjusted is so important. And that's why spinal decompression is so important. And these are really anti-aging exercises or anti-aging treatments, because as we get older, we can get shorter. So to keep you from being shorter, spinal decompression is something that I really urge a lot of you to do if you haven't done it already, or if you have not gone through the steps. Because if you need it and you haven't done it, or maybe you don't know whether or not you need it, maybe all your spine, your whole spine is good and you have nothing that's collapsed and everything's great, but maybe it's not. And you keep doing the same thing, getting the same therapy, and something's just not right and it's not getting better. That's the time to get a second opinion. So if you're in the area, give us a call. Don't hesitate to give us a call and have us reevaluate your body. Maybe your body has been doing the same thing for a long time and you need someone else to reevaluate it. A fresh set of eyes, someone who's up to date on everything. We have digital x-rays in here. We do top-notch exams. And if you need spinal decompression, or if you need to change up your adjustments or your alignment, we'll let you know. Okay? Have a great day.